Once a numbing pain wears off, it's definitely uncomfortable. I used to prescribe oxycodone only and tell patients they could take Tylenol or Motrin with that. I have started prescribing something called Journavx. It's a new opioid alternative, which is great. So you take two of those, 250 milligram tablets in the morning, and then one that evening when you get home. And for some patients, because I have some patients who are super motivated not to use narcotics at all, that's all they need. They can take that and Tylenol. Most patients, since we've just started doing this, are taking one or two oxycodone that first 24 hours. So before I had the Journavx, I would tell people to go home, take the oxy, and then if you need another one, you need another one. But at least have it on board before the numbing wears off. And I mean, most patients again probably use 3 or 4 oxycodone in that first 24 hours max, and a lot less with the Journavx. Again, it's a little painful the first 24 hours, and then after that, it's really just uncomfortable because you're swollen. So it's pain medicine is not necessarily going to help you, but icing will. If you've had kids, then most of those patients are pretty adept at dealing with this. I would say, though, the majority of my patients have not had children and are in their 20s. Some of them are 30s and haven't had kids. So it's funny, some of the best tips I've gotten for post-op regimens have come from women who had kids. And Bree and I we have 5 kids between the two of us, are absolutely useless for this because we had sections. So we've had 5 C-sections and we don't know jack about all the stuff that they do once you've delivered vaginally. We're like, wait, what? We didn't get any of that. So we give patients an action like little baggie with them. And so like dermaplast spray is one of the things we give them. So I personally haven't used the dermaplast spray, but one of our patients suggested it afterwards and said, hey, I use this after having my kids. Can I use it now? And I said, yeah, that sounds great. And then we asked her more about it post-operatively. And we're like, we're just going to include this in your little baggie, your to-go baggie. So that's been one of them. They make these like kind of period panties or like post-maternity panties. They're like that have pads in them and also an ice pack can slide in there. Did not know about that postpartum. Yeah, so now we give everybody one of those, put an ice pack. It slides an ice pack that you can slide in and out, and you wear these kind of disposable panties. And then they also get some arnica, a little bit of Aquaphor to put on the incisions. That's kind of the basic kit and some pads. But yeah, I mean, we had started with just like, here's the ice pack in your underwear. And go home. And then we had to be more specific because people showed up without underwear, with a thong. I was like, no, 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 no. Yeah, a thong. Like, where am I going to put the ice pack in? So anyway, so now we're like, here's your underwear. Here's these like maternity panties you can put on, and that has an ice pack that slides in there. So it sets them up for success. Oh, and then we also give a peri bottle. That's another like postpartum thing. So the little squish bottle that you can fill with warm soap and water and like spray off the area after you go to the bathroom because, you don't want to be wiping too vigorously down there after the surgery. Like I said, we're always looking for anything else that complements that post-recovery care kit besides, endless episodes of Love Island. But it's really just feedback from our patients on, what makes something a little bit more tolerable.